like Mr. Stace said, I'm Mary Catherine Carlisle, and I am with the State Employees Insurance Board. And so today, what we're going to do is we're just going to have like a benefits overview. Who all here, I'm just curious, who all here is like brand new within your first 90-ish days? Wow, okay, cool. So some of this information I'm about to share, y'all may not have heard yet, but for some that have been here a little longer, you may already be familiar with all or most of what we're about to talk about. So let's go ahead and jump in. Who's super excited to hear about insurance? Yes, I love it. Love the enthusiasm. Okay, so let's just go ahead and dive in and look at our health insurance plans. We actually have quite a few options depending on what your situation is. First up, and we're going to go over all of these in more detail, but first up, we have the State Employees Health Insurance Plan. Of course, we're at the state, so we have an acronym for everything. We call this one SEHIP, and this is what probably 90% of all state employees have. This is the one that you pay the premium for. This is the one that's Blue Cross Blue Shield for the health and hospital benefit, and then it's Optum RX for the pharmacy benefit. So again, this is very likely probably what you already have. It's what I have. And it's for those that don't have any other group health insurance available to them. And then next up, we have our free plans. So free is exciting, right? Yay, I love free. But these plans are for employees that have other group health insurance available. So that means that their spouse or their parent, if they're under age 26, or a former employer has offered them other group health insurance. So if that is you, then you may qualify for a free plan. So we're going to talk about all of these in more detail, but let's start, back it up just a bit and start with SEHIP. Okay, so these are our premiums, and let's see, oh, there we go. These are our premiums, and I've got them listed here as like their base rates. So don't really panic just yet. These are before any discounts are applied. And, but this is, this is our Blue Cross Blue Shield, like I said, hospital benefit, Optum RX, pharmacy benefit. I mentioned discounts, and I love to save money. I feel like almost everyone does, right? Yes. Yep. I know. So let's look at those discounts. So first up is the non-tobacco user discount. That one is $60 per month off of your monthly premium for yourself, the employee, and then also the covered spouse, if you have been tobacco-free for at least a year. Yay! So if you're on your contract with your covered spouse, off the top, that's a $120 savings per month. Awesome. Yes. Next up is the wellness discount. Who has had their wellness screening? Perfect. I know things are a little different this year with COVID, so, it's not like it's been in the past where it was probably a little easier to go and get that screening taken care of. But the wellness screening discount, that is $25 per month off of your premium for yourself and your covered spouse if you go and get your wellness screening. So we'll talk about that in some more detail because there are a couple of extra things to know about that wellness screening discount. And if I look at, I'm going to totally call attention to you. If I look at Mallory and shake my head a lot talking about wellness, that's because she is one of our managers in our wellness department, and she knows everything about wellness. So don't be embarrassed, I'm sorry. But again, we'll come back to wellness in just a second. Next up is the spousal surcharge waiver discount. So So that is $50 per month off of your health. Ooh, sorry guys, off of your health insurance coverage. I won't touch that again. And that is for one, if your spouse is a stay-at-home parent, and so they don't have access to group health insurance, or if they do have access to group health insurance, but it costs more than $255. Is that like a jackhammer? Okay. If it costs more than $255 per month for individual coverage, then you may qualify for that spousal surcharge waiver discount of $50 per month. I'm a little ADD, sorry. And then finally, the last one is the federal poverty level discount. So this particular discount is anywhere from 10 to 50% off of your monthly health insurance premium. And the way we determine if you qualify for that discount, it's based on total household size and total household income. And we actually have those guidelines posted on our website. And that website is alseib.org. That website is on my card that's at your desk and also on that benefit guide. But you can go there and you can look at those FPL guidelines and see if maybe that applies to you, and you could potentially save even more money on your premium. All right. Wellness discount. Mallory, I'm looking at you. It's just like a weird habit. First of all, who is required to participate? If you're an active employee, which is everyone in this room, and also if you have a covered spouse that's on your contract, we would encourage you to participate in the wellness screening discount. And once you retire and you're Medicare eligible, at that point you no longer participate. But I'm sure for almost everyone here that is quite a ways away. But what's required in order to get this wellness discount is to go and have a wellness screening performed by October 31st of each year. And good news, because I know we're a room full of new, if you've already had your screening for this year, it's actually going to cover you through the end of this year and all of next year too. So yay, that's a bonus. But this is something that you have to have done every single year if you want to receive the discount through that following year. And you have to have it done by October 31st. That is the deadline. And that's true for the employee, and that's true for the spouse that's covered under the employee's contract. So if you haven't had your screening, you may be wondering, where can I get screened? Well, that's very simple. A lot of agencies actually offer worksite wellness screenings, and but don't worry, if your agency does not do that, that's okay. You could also go to a county health department and have a wellness screening done. I know not everyone works in Montgomery, but if you do, or while you're here, you could also go to the State Wellness Center, which is here downtown, and have a wellness screening performed. I would certainly recommend calling ahead and getting an appointment for that. But outside of that, you could also visit a participating pharmacy. If you're wondering what pharmacies are participating, you can go to our website and you can actually search by county and you can see what pharmacies in your area are participating. Another COVID caveat here, call ahead and make sure that whatever pharmacy you plan on visiting is actually offering screenings right now. Normally they always are, but again, because of COVID, things are a little different right now. So be mindful of that, call ahead and see if you can actually, even schedule an appointment, so that would make it even easier. And it only takes about, 15, 20 minutes to get screened. Very, very simple. Finally, the last option here, you could go to your healthcare provider. But something to keep in mind about going to your healthcare provider, you are subject to the copay. So $35, but you may decide that you want to go ahead and get it taken care of there. For instance, like I don't think I addressed this, but the reason we're even getting these wellness screenings is because we're looking at 4 different areas. We're looking for, risk factors in 4 different areas. And those areas, hopefully, are on the next slide. Oh, there they are. And those areas are blood pressure, cholesterol, glucose, and BMI. So let's say you already know you have high blood pressure. You might just want to go ahead, you're going for your annual physical anyway. You might want to take the provider screening form down on our website to your doctor and go ahead and get that physical there. That would be your whole wellness screening. The reason I mentioned that is because if you are outside of whatever the normal range is for any of these items, then you will be given a form to follow up with your healthcare provider. That form will waive the copay, and you must go and get that taken care of, or your wellness screening discount would not be complete. Does that make sense? Everybody?
Yes.
Mallory, am I leaving anything out? But that is kind of, in a nutshell, the wellness screening and the discount. And that is true again for your covered spouse. The same would apply. And again, y'all please feel free to stop me if you have any questions or if I'm going too fast, just like raise your hand and I'll take it down a couple of notches. Something else that is included with our wellness program is the Gaps in Care Wellness Incentive Program. And what this is anyone familiar with this part? Probably only Mallory and Jeannie. But what this is, it is designed to identify certain national standards of care that need to be completed in order to support your overall health. It's a lot of words. And this information is all available online. The categories that are currently being monitored with our gaps in care are all listed here. And again, you can also find these on our website. But let's just, let's look at an example situation. Let's say that you need a colonoscopy and you receive something in the mail from Blue Cross Blue Shield, because that's who will send them out, like a care alert, and it's saying, hey, you need to get your colon cancer screening taken care of. Okay, well, if you don't get that taken care of by October 31st, you could potentially have an additional $25 charge tacked on to next year's premium, beginning in January. So super important to make sure you get that or any of these other applicable, that's a hard word, gaps. If any of these apply to you, they don't apply to everyone. So like they're based on gender, age, other like pre-existing conditions you may have. So these aren't necessarily going to affect you, but this is what is currently being monitored. Yes, please add.
I will say colon cancer screening does not mean you have to have a colonoscopy.
Yes, good
There are
point.
other options, but that is one that you would have to get taken care of if your doctor wants you to only have a colonoscopy. Obviously, you follow their order, but there are other options for that gap closed.
Absolutely, thank you. In case not everyone, can everyone hear that? Okay, Mallory brings up a really good point. For the colon cancer screening, colonoscopies are not always the only option unless your care provider has specifically said you need to have a colonoscopy. There are other alternatives if you need to have this particular gap closed. For instance, like Cologuard is one, like less invasive options do exist unless your doctor does specify you need a colonoscopy. Thank you, Mallory. And so any questions about gaps in care? We have like literally the queen of gaps in care in this room that could answer any question you may have. I could give it a try too. Yes, ma'am.
How far in advance would you get notified that you would have to do one of these? Just curious.
How far in advance are we notified about the gaps? I think your claim history has to build up first, right?
Yeah, they do a 3-year look back. Sorry, I'll just
You didn't know you're part of the presentation.
I'm one of those people that Stacy mentioned yesterday that does not like public speaking.
I'm sorry.
It's okay. They do a 3-year look back for most of the gaps. Obviously, for colon cancer screening, if you've had a colonoscopy, it would be 10 years, not 3. So if you have prior coverage and Blue Cross is not able to capture that gap, they usually send letters out beginning January or February if you have a gap that's applicable to you based off of your pre-existing condition, your sex, or your age. So if you get a letter and it says that you have to have, we'll just continue with colonoscopy, that you have to have a colon cancer screening, but you know that when you were covered under a different plan, you had one done in 2017 and you're not going to need one. You just call the agency, we'll get it taken care of, we'll send information to Blue Cross, we'll get it closed and put you on the list for it to not trigger until it's applicable.
Thank you.
Or if you've had certain things removed to where you can't get that test done, then we would need to know that as well because Blue Cross may not have that information.
Right. Thank you so much, Mallory. I promise I won't do that again. It's just so good when you have someone so knowledgeable. I mean, I hate to like kind of cheat like I just did, but it's just so good. Okay. So, any other questions about wellness or gaps in care? All right, well, let's continue on. So, just some information, some general information about our discounts. All of our discounts, waivers, and incentives are prospective, and they can be earned the first day of the second month following the SEIB's receipt of the discounts or the form or whatever. So just because you send it, did I say that wrong, Jeannie? Or are you just shaking your head because that's a lot of words?
Yeah, the wording's so bad.
Yes, there's a much better way to word that. It's not coming to me, unfortunately, right now. But basically, when you send it in, probably not the best idea to assume we're going to get to process it that very same day. So like if
Basically, it's triggered, like the discount is applied the following month.
right, thank you. Yeah, okay. So the discount will be applied the following month. There, that's a lot better. That was a lot of words. To say simply that yes, it would be applied that following month. Thank you. And you know, in the event that you did not get to submit whatever information on time, so that you could receive that discount in a timely manner, unfortunately, in that instance, we would not be able to give refunds. So if it's something that occurred because of something that happened on your end, we're not going to be able to take care of that. If it's ever something on our end, an error that we have caused, we are really great about going back and refunding. So don't ever worry. If it's on us, we like to fix it. I promise. And if you have any questions about anything we've just talked about, any of these discounts or waivers, again, go to our website, alseib.org. And a good thing, while we're here, we can talk about this too. While you're at our website, if you haven't done so, go ahead and create a My SEIB account. All you need is your 901 contract number, and you will have just like an overview of all of your insurance information. You can make sure your contact information is up to date. You can look and see and make sure you're getting all of your discounts. You can see who's covered under your policies. Everything just lives right there, and it's such a good resource. And it would save you the time and inconvenience of having to call or email us, which we'd love to hear from you, of course. But it's just a lot more simple, if you will. Just to know that you've got all that information in one spot. So definitely consider creating one of those My SEIB accounts. All right. So real quick. Federal poverty level discount that I mentioned earlier, that is something that goes directly to our accounting department. And right now, let me back up. Typically, we are looking for the application, which is found online. You would need to complete that and submit that directly to our accounting department with your tax transcripts. Okay, tax transcripts, not tax returns. However, again, because of COVID, we are currently just, I think for the next couple of months, Judy, accepting notarized tax returns in lieu of the tax transcripts. That is only for now. I think after September or October, it will go back to tax transcripts. But for the moment, tax returns notarized with the FPL application can be sent directly to our accounting department to be processed. Any questions about any of that information? All right. Are y'all still awake? Am I boring you?
No.
Oh, thanks. Okay, so let's touch back on the wellness program. These are actually just some, neat extra benefits that the SEIB offers to all state employees. And again, these are, of course, listed on our website. We offer things like the Participating Exercise Facility Program. There are certain gyms in your counties that participate in this program. You can see which ones do participate on our website. But if you decide to look into that, you can do things like waive contracts, waive sign-up fees, have your monthly dues directly taken out of your payroll, neat stuff like that. So that is one of our benefits included under wellness. Also, we will reimburse you up to $150 per year for approved physician-supervised weight loss programs. It does have to be under the care of a doctor, and it also includes nutritional counseling, again, under the care of the doctor, but we'll reimburse you the cost of that up to $150 annually. So that's a neat little extra benefit. Also, we offer a tobacco cessation program, and for our employees that are covered under SEHIP, Baby Yourself maternity program that is offered by Blue Cross Blue Shield. And so, and a side note about that, if you do enroll in Baby Yourself before the end of your second trimester, you won't have to pay like a copay when you go and deliver the baby. A lot of stuff is waived. I'm looking at Jeannie because she just recently had a baby, so she knows all this information. Sorry, Jean, putting you on the spot. So that is something neat that not a lot of people are aware of that we do offer. Okay. Mr. Stace, am I okay on time? Okay. All right, so the State Wellness Center, I mentioned it just a little bit ago. That is in downtown Montgomery, and I hate to talk about it almost in front of employees from other counties because they don't have such quick and close access to it because it is so great. But what it is, it's kind of like an urgent care and a pharmacy. It's only available during business hours, so Monday through Friday, 8 to 5. And it's free for state employees to go to. And so like at a normal urgent care where you would pay $50 for your copay, there's no copay to go to the State Wellness Center. And again, like I said, there's also a pharmacy. And inside of that pharmacy, there's like a little one-stop shop with over-the-counter medicines that are available at extremely reduced prices, much cheaper than you would find them at Walmart or at Target. So that is a really cool benefit too. Again, I almost hate to mention it in front of employees from other counties, but the reason we do have that here is because Montgomery has the largest concentration of state employees. So it just mathematically made kind of more sense to have that here. Can y'all still hear me okay? Okay.
Yeah.
Perfect. I felt like I was kind of slipping out there. Teladoc. So who in here is familiar with Teladoc? I love it. I love Teladoc. Teladoc is, again, I just mentioned urgent care, but it's like an urgent care available on your phone for free, 24 hours a day, 7 days a week. And again, this is only available to those with SEHIP unless your primary health insurance provider participates in Teladoc. But it's only available for our purposes for those covered under SEHIP and you have 24-hour-a-day, 7-day-a-week access to a physician on your phone. You can use the app, which is what I prefer to do, and you can just request a visit. You can schedule it for as soon as possible, and you'll have a doctor call you back, or you can even like FaceTime with a doctor as well. I've done both, and they're usually really quick about calling you back within 5 to 10 minutes, unless it's like flu season or COVID season. It can sometimes take longer, but it's generally a very, very quick turnaround time, and it's really good just for stuff like flu, stomach virus, even pink eye, which is gross, no one wants to talk about. But those are just examples of what you can use for Teladoc. Now, of course, Teladoc is not for pain management. It's not for emergency care. We would obviously want you to see your doctor or go to the emergency room for those types of things. But just, for the common cold, call Teladoc. And it's also good if you are, let's say, on vacation in Disney World and you forgot your blood pressure medicine. You can call Teladoc, and they will call in a week's worth of your medicine at a local pharmacy in Orlando for you to go and pick up. So you don't have to worry about missing out on your meds. So that is just kind of a handful of things that Teladoc is great for. And again, totally free. So definitely a wonderful benefit that we offer, and I love it. Oh, and by the way, if you have dependents or a spouse, they can use Teladoc as well. Okay, so I mentioned the free plans. Let's kind of jump into those. First up, the supplemental plan. Again, let me just remind y'all that all of these free plans I'm about to talk to you about are for those with other group health insurance. So that's like, again, if you're under 26, your parent has your health insurance coverage, or your spouse has your health insurance coverage, or a former employer. That is who the free plans are for. And so the first one is the supplemental plan. That is a Blue Cross Blue Shield plan that is meant to eliminate co-pays, co-insurance, and deductibles that your primary coverage does not pay 100% of. So it can certainly be a huge savings to our members if they qualify. And something to keep in mind about the supplemental plan, it does not coordinate with high deductible plans. So if your primary insurance deductible exceeds $1,350 for individual coverage or $2,700 for family coverage, unfortunately, it wouldn't coordinate with supplemental plan, but I'm sure we have something else that would. So y'all just sit tight. I'll tell you about all of them. Any questions about supplemental? All right, so next up is the optional plan. The optional plan is a Southland Benefit Solution administered plan, and it includes dental, vision, cancer, and hospital indemnity coverage all rolled into one plan, all for free. Wow, it is wonderful. If you were to pay for each of these separately, you would be looking at paying upwards of $750 per year. In general, the employees, or actually I guess retirees, that seem to love this plan the most are my TRICARE for Life retirees. It's compatible with more than TRICARE for Life retirees, but I see a significant number of those retirees that really enjoy this plan. It may be compatible with yours also. I would love to talk with you about it if you're wondering, so just see me afterwards. I'll be here after the break, myself and Jeannie Blake back there. But something to keep in mind about the optional plan, there is a 12-month minimum enrollment requirement. So you have to stay enrolled in this plan if you choose it for at least 12 months. Unless, of course, you lose access to whatever that primary other group health insurance is. Any questions about supplemental? optional or either. Y'all are getting quiet on me.
It's not you, I think it's the masses.
Okay,
It's just a different environment and
Totally.
people feel more restricted.
definitely, I understand. I feel very restricted in mine, like to the point where I'm almost having panic attacks. So that's fun. But yeah, it's just a different time. Yes, ma'am.
Does this plan actually have a name if someone called on it, or
It does. It's called the optional
just
plan.
the optional plans all?
Yes, ma'am.
Okay, just want to make sure I've got that, okay.
All right, and so the last free plan that we have is called the premium cash option, or the PCO for short. And what the PCO does is it offsets the cost for the premium of your primary group health insurance. And it will pay you directly up to $175 per month. Wow. And I think a lot of people hear that and they think, okay, that sounds too good to be true. But no, it is absolutely true. And it is administered by Connect Your Care, the same group that administers our flex benefits. They make it really easy. They actually have an app. You can go online or to your app and set up recurring reimbursements to yourself, again, automatically up to $175 per month to offset the cost of your other group health insurance. Any questions about the PCO? Again, I'll be available after the break and I can answer any questions that you have. You got a question? Oh, okay. You look like you might be on the verge of one. All right. Oh, and something else to note about the PCO. If your monthly premium for your other group health insurance is less than $175 per month, whatever the difference is, let's say the premium's $100, which probably almost never happens, but if the premium's $100, that extra $75 would go in a notional account for you to use in retirement toward premiums. So yeah, that's a really good deal. Unfortunately, if you separate from state service for any reason other than retirement, the funds in that account would be forfeited, which is a bummer. But if you, stay through retirement, you can use the funds in that account toward your premiums in retirement. So that's pretty cool. So we're about to go into the standalone coverages. Before we do, just one last call for questions about the free plans. All good? Okay. So our standalone options for dental, we do have Blue Cross Blue Shield Dental and Southland Dental. And you can choose between the two. So they're both great. They both cost exactly the same thing. For individual coverage, it's $8 per month. For family coverage, it's $15 per month. Some differences that I'll highlight about the two plans. Did you have a question? Okay. I'm so ready with questions, y'all. The biggest difference with Blue Cross Blue Shield's dental plan is the orthodontic benefit. So if you have dependent children under 19 on your dental policy with Blue Cross, they have up to a $1,000 lifetime orthodontic benefit. Yes, ma'am.
I just had a comment on that. I had dental coverage with the school district prior to coming to the state, and my child had gotten braces probably a couple months before I stopped. And when I got that, I was able to call the orthodontist, and they went ahead and adjusted my feet for that $1,000.
So it saved you like $1,000? Yes.
They went ahead and they would send me the workup again of what I'm paying. So I mean, they were immediately able to do it. So it's something to look at if you guys have anybody that's doing or has braces already.
I love hearing that. So she was able to, for those that could not hear, she was previously with a school system, and when she changed over to state service, her child had braces or was in the process of doing braces, And when she swapped over to Blue Cross Blue Shield Dental, she was able to get a $1,000 adjustment.
Yeah, because her payment used to be like $200 a month or something, so now it's like $150 a month
Yes,
for her. And so they just went ahead and took that $1,000 off what I had already agreed to pay.
that is awesome. Thank you for sharing that. I love happy stories. Love that. And then, but again, they're both good. Southland's good too. Something neat about Southland's is it does cover a slightly higher percentage on basic and major services. So like, I guess, getting a root canal, which isn't nearly as exciting to talk about. But they will do a little bit of a percentage off on those basic and major services. Okay, so any questions about dental before we move on? Okay, so that is our dental. You can choose between either Blue Cross or Southland. Next up, we offer a cancer policy also administered by Southland. And a couple of neat things about this policy, there is no pre-existing condition that would prevent you from participating in this policy. So if you've previously been diagnosed with cancer, you can still participate in our cancer policy. This will also pay you directly based on treatments or hospital stays relating to your cancer diagnosis. So that is pretty great. The cost for our cancer policy is $12 per month for individual coverage and $24 per month for family. Any questions about cancer? Okay. And then lastly, we do offer a vision policy also through Southland. And it too is $12 per month for individual, $24 for family coverage. And it's a standard vision policy. It does things like $75 toward eye exams per year. So, nothing too exciting there. Although, if you wear glasses or contacts, it may be worth the cost of those monthly premiums because it may save you money. It just really depends on your individual situation. And we do offer a full list of the benefits of our vision policy, again, on our website. Such a good resource. Check that out and see if maybe the vision policy would be a good fit. I personally don't have it, but I don't wear glasses. Mallory has it. So yeah, must be good if Mallory has it.
Yes.
Yes.
About that. I do have the vision policy, and then I was looking at your handout on the vision care networks. Can you still use that if you have vision insurance, or can you explain that a little bit?
Sure. So we do have a vision care network for state employees. One, word of caution here, it's not as large as it used to be. I'm right with that, right, Jeannie? Yeah. So it's not quite as large as it used to be. I would certainly call and check with your eye care provider and see if they're part of that network. Because if they are, I think you can get things like a $40 eye exam, really good savings, probably, I think, on glasses and contacts. Yes, Jean?
Okay, so the discounted vision care network tool on our website, again, like Mary Beth was saying, you can go under our vision tab and you can actually see a list of providers that they participate. It's done by providers. So like if you go to LensCrafters, not all doctors at LensCrafters are going to be in this network. So you have to search by provider. You can get a $45 eye exam. They are going to charge you an additional fee for like a contact fitting. So like if you go and you expect to just take like $45 is just for the eye exam. So there will be additional costs. But it can save you money because I think on average an eye exam at the eye doctor is around $78. So using the discounted vision network, it is a good resource if you don't have the insurance. If you do have insurance, you can still utilize it. It's just something where that's kind of where we say, like, for Mallory, it works because she wears glasses and has, but like Mary Catherine and I, we don't. So it's more beneficial for us to just pay out of pocket and use the discounted vision network than it is paying a monthly premium for that. Right. Insurance.
But you can use that and your vision insurance. Okay. Thank you.
Thank y'all. That was really good, and thank you, Jeannie. Just for those, go ahead.
I wound up signing up with a cancer policy with, I think, like COA. Is that the same thing as this, or is that different?
It sounds like it's going to be different. Did you Did you say the name of the provider?
I have it at home, I don't remember.
Okay, it sounds like it's probably different, but that's okay. You could also sign up for the cancer policy through the state. It will, work with other cancer policies that you have. It also coordinates with your existing health insurance. So it's just really meant to be something in addition to what you already have. And it does pay you directly. I'm not sure if I said that, but that is another benefit to this particular cancer policy. And for those that maybe couldn't hear on this side of the room, back to the eye care network that we have, or vision network, you can use that with our vision policy. Again, just, call, make sure your provider accepts or is a part of our vision care network. And then also, just really also, in the Southland, with the Southland Vision, we have online available, you can see if your eye care provider accepts Southland. So those are really good things to check into before you commit to the vision policy. And something else, all of our standalone options, they all have a 12-month minimum enrollment requirement. Okay, so be mindful of that before you enroll, because you don't want to get locked into something that you don't love, and then you're stuck paying for it. And I wouldn't be able to get you out, so make sure you're ready to commit for at least a year.
Just double check on what you just said there. If you're already enrolled when you first started, like the first week, you're already locked in. Nothing you can do.
Unless you're within your first month of employment. Yeah. Oh, yes, ma'am.
Just comparing I know you mentioned the optional plan earlier. That's different from this because optional plan, you have to already have insurance. Is that correct?
You're exactly right. That's a good question. She was asking about the difference comparing our standalone coverages to the optional plan. Yes, so the optional plan, again, is free. If you were to purchase these coverages standalone, you have to pay the premium. It's all Southland. So it's the Southland Dental, Southland Vision, and Southland Cancer. And then the bonus of the hospital indemnity that we don't offer as a standalone plan. Does that kind of answer your question? Okay, good. All right. I'm about to move on. If y'all think of anything, question. No. All right, so this is actually my favorite part. If you just notice my excitement kind of cranked up a little bit. I love Flex. Flex is my favorite. A flexible benefits plan. Who in here is enrolled in Flex? Yes. Oh, I feel like more people can love this. So let me tell y'all. Let me tell you. All right, so our flexible benefits plan is separated into two accounts. We have the healthcare part and we have the dependent care part. I'll talk about the healthcare part first. That is what most employees associate with Flex. When you hear my Flex card or my Flex account, in general, our employees are probably referring to the healthcare reimbursement account. And it's super neat because you can use the funds in that account to pay for things like co-pays at the doctor's office, at the dentist, at the eye doctor. If you don't want to do the vision insurance, you could just pay for vision using your Flex card. Glasses, the exam, the whole thing. You can also use Flex for your pharmacy co-pays. You could use it for therapy. I like to talk about therapy. I feel like everyone can benefit from therapy, but you can use it there at the therapist's office. There's even a website, again, it's ours, alseib.org, where we have linked the flexible spending account online store. And you can go to that store and you'll know that every single thing on that website is eligible for you to purchase using your Flex card. Tons of over-the-counter medicines, reading glasses, sunscreen, Band-Aids, nursing supplies, certain baby formulas, like all kinds of things you can find online. You can also purchase those at like Target or Walmart, but that store does make it super convenient. You also wouldn't have to submit receipts. But anyway, let me back up a little bit because I think I got too excited and got carried away. So those are all the ways that you can use your Flex card. But let me tell you more about it. All right, so the minimum that you can enroll in is $120 per year. The maximum is currently $2,750 per year. Now you're wondering probably, how am I funding this account? Well, you're doing it through your pay. You would do it pre-taxed. So like that is the benefit. It's a pre-tax contribution. And if you want to know exactly how much that amount is, you would just, let's say we're enrolling during open enrollment. So we have the whole year 2021 in front of us. Let's say you want to elect $1,000. And so if you're wondering how much is going to come out of each paycheck to fund that $1,000 in your flex, you would just divide 1,000 by 24. I am not a math whiz. Sadly, I can't tell you what that number is off the top of my head. But that is whatever you calculate that to be. That is what would come out of your paycheck. And that, again, is pre-tax. So, like, you don't have to worry about trying to figure out taxes or anything like that. And, again, whatever amount you choose, let's say you, back to the same example, went with $1,000, that full $1,000 is available January 1. Even though you haven't had all of your pay periods to fund that account, it's available up front. So, not only are you getting the tax benefit of contributing to the account, you're also getting the bonus benefit of having access to it right away before you've had a chance to fully fund it. So that is awesome. And it doesn't make sense for everybody to have it. I do highly, encourage people to consider it. Even if you just want to try the initial 120, just to see if you'll use it. But it's not for everyone. If you don't have a lot of medical or health expenses, it really wouldn't make sense.
Catherine?
I used it with PHIP in 2007 to cover my LASIK surgery.
Yes.
It was the best money I've ever spent on myself
Yes.
in all my 47 years.
Yes.
And I mean, $4,000 worth of surgery paid for right then. So, I mean, if you're young and you think that you would qualify for something like that, it's well worth it.
A lot of people do that with LASIK. They will enroll in the full amount and then use that, first month of the year for LASIK. That actually happens a lot. So that's a really good idea. It's an excellent suggestion. And any other questions about Flex, about the healthcare part of Flex? Am I making it make sense for y'all?
You still offering $50 if you sign up?
Yes, thank you. Yes, so if you sign up for Flex, you get $50 for free, just for enrolling. If you, enroll in 120 or 2,700, you get $50 for free. And that is every single year that you enroll. It's just our gift to you because we love y'all. But something else to remember about Flex, we also have a rollover provision. And so what that means is that you can roll over up to $500 of unspent funds to the next year as long as you re-enroll. Now, let's say, for example, you had $400 at the end of the year and you did not re-enroll. That is so unfortunate because you would be forfeiting all 400 of those dollars. They would be gone. And I would literally sit on the phone and cry with you and mourn those $400 because you could keep them if you re-enroll. During open enrollment, you can roll over up to $500. Now, sadly, if you have anything over $500, well, that is gone. So you want to try to spend that up, at least up to the $500 by the end of the year, so you're not losing. You don't want to ever have to lose any of the money. Yes, ma'am.
You find yourself in a situation where you're coming to the end of the year and you have that 400 that's going to roll over.
Right.
So if you decide maybe it wasn't as beneficial to you, are you still best off to at least enroll in the 120 plan for the next year to use up that 400?
I absolutely would. Yes, that is a good idea. So she had just said, let's say for an example that you enroll in $400 and you didn't use any of it. And you come to the end of the year, or you come to open enrollment in November, and you're like, I didn't use any of that money, and I don't see myself using it by December 31. I would strongly encourage you to go ahead and enroll at least like 120 during open enrollment, just so you don't lose your $400. Because you'll have that rollover provision. That if you don't re-enroll, you'll like totally, lose your money. And you don't know, you may need glasses next year. Well, that would be perfect. That would take a huge chunk out of those glasses. So, just really, you don't want to have to lose any of your funds in the account. So just really make a, good choice and look at all of your options. We also, something else that's cool, on our website, we have a calculator, a flex calculator, where you can input how much money you make per year, what your tax percentage is, and what you're thinking about electing for flex. And you can put that in the calculator, and then you can see how much you can expect to save based on that. So, and I have an example coming up so you can see that. But first, let's talk about the second part of flex. It's not something that is as widely used as the healthcare portion, but I use it and I love it. The dependent care reimbursement account. So this is for daycare expenses. You can use it for summer camps if it's not COVID, and you can use it for elder care expenses as well. The maximum amount that you can contribute is $5,000, and if you have a child in daycare like myself, you know that you are very likely to use all of that $5,000, if not more. So it can be an excellent tax benefit for some, not for all. Again, we have that calculator on our website that can give you a good idea about your savings. You can certainly ask the person that prepares your taxes if you think this would be good for you. Most people will find that there is a savings associated with doing the dependent care account versus something like the child care tax credit. That is true for me, but again, it's not true for everyone. There is no rollover provision for this account, which is sad. But again, if you have a child in daycare, you will likely use all of the money in the account anyway. Also, with dependent care, there is no card. You do have to pay your provider directly. And so, beginning actually this year, we started doing dependent care on demand. So that means whatever amount you choose, up to $5,000, is available beginning January 1. So you no longer have to wait for the account to be funded as you did in previous years before you could use it. So how it works is I pay my daycare provider directly. They send me a statement. I pull up my little Connect Your Care app. I take a picture of my statement. I upload it directly to Connect Your Care. I select the button that says Pay Myself, two of my favorite words, and I submit that off to Connect Your Care. And within 2 to 3 business days, they reimburse me the cost of my child care. And I'm funding this account just like we talked about with healthcare. I'm funding it before taxes. So that's where the savings comes in. And again, it's all available up front. It's so nice because it really does, for me personally, it takes kind of like a financial burden almost off of me when it comes to paying for my child's care. Now again, that's not going to be true for everyone, but it's definitely, again, something to consider.
Almost sounds like a 0-interest loan for the year.
Kind of is, yeah. That's certainly one way to look at it. Because again, you're funding it before taxes, and so it's, I have really enjoyed it. This is the first year I've been able to participate in it, and let me tell y'all, I'm so thankful for it. I love it so much. So I'm really passionate about flex in general, but more so dependent care now that I've actually had a chance to use it. So any questions about dependent care or the healthcare flex?
Oh, when does the rollover begin? Is it like a specific time?
That's a good question. Okay, so with the rollover for the healthcare part, that up to $500 you can roll over, yes. You're not going to notice it as a part of your available balance on January 1. It's there, but you're not actually going to see it in your available balance until like April. So if you wanted to use your card, you wanted to swipe your card, you could not do so. Let's say you enrolled in $1,000 and then you had $500 rolling over. You wouldn't be able to use your card for $1,500 until like April 15th. It is available. You could reimburse yourself for that $500 beginning in January, but it's not on your card.
Okay.
Until then. So that is something to consider.
Another question. So when you supposed to sign up, re-enroll each year?
You can enroll during open enrollment. We'll talk about that in just a bit.
Oh, you will? Oh, okay.
Yes,
Okay.
yes.
I thought you were moving to something else.
Oh yeah, don't worry. But yes, you can enroll in Flex or make changes to any of your plans without a qualified event during open enrollment, and that is in November. And we'll get to that in just a bit. But it's probably a really good idea to save a bunch of time, just so nobody forgets, because you don't want to forget about open enrollment. We will send you reminders. We'll send stuff in the mail and email. We'll hopefully have the capability to actually text you reminders here in the coming months. And so I don't want to get too excited about that because just in case it doesn't work out. But I'm very hopeful that we'll have that texting capability soon, because I think that will be really convenient. I know I'm more likely sometimes to pay attention to my text messages than I am to my mailbox. Okay. Maybe that's just me, but all right. So back to that calculator on our website. This is an illustration of that. So in this example, the employee makes $43,000 per year, and they decided to enroll in $2,000 for the healthcare reimbursement account, and they were able to save, in this example, $453 per year. And that just feels like a lot for me. So definitely I encourage you to go to that calculator, put in your information, and see, if you've got health expenses anyway, this is wonderful, just to give you an idea of what you can expect to save. And this is the same illustration, but with dependent care. And in this example, the employee makes $43,000 again, and they enrolled in the full $5,000 for dependent care, and by doing so, saved over $1,100. So that's like a combined total of $1,500. That's a purse, a fancy purse. It's a purse. So, I mean, you can do a lot with $1,500. And so definitely check these calculators out, put in your own information, and just see, if maybe there's room for you to save money. I really encourage that. Important dates. We were talking about open enrollment earlier, and those are the most important of all the dates in our insurance world. November 1st through November 30th. That is the time to make plan changes, status changes. You can enroll in Flex. Here's a secret to Flex enrollment. If you created one of those My SEIB accounts online, you can actually enroll in Flex through December 15th. Online only, but that is an option for you when you have the My SEIB account. That's another good reason to create a SEIB account, because it gives you extra time to, like me, pay for it. Does that happen? Any questions about open enrollment? Yes?
So I started April 1st and I enrolled in Flex when I started. Do I still do the enrollment again in November?
Yes, if you want it for 2021, absolutely. And again, if you have anything left over up to $500 by re-enrolling, you get that $500 rollover provision up to $500. Any other questions about open enrollment? Some other dates, or deadlines rather, to keep in mind are wellness discount deadlines. Mallory, I'm looking at you. But for new employees, you do have 60 days after enrollment to get your wellness screenings taken care of, for your covered spouse to get their screenings taken care of. For the year in general, for existing employees, your wellness screening deadline is October 31st. That is the deadline for the actual screening. That is the deadline for any follow-up forms that you receive, if you receive them during your screening. October 31st, remember that date. Halloween, that's an easy way to remember it. And then also October 31st, if you have an identified gap in care, the deadline to have that information, if you need to, submit it to Blue Cross is October 31st. If that applies to you, again, it doesn't apply to everyone, but if you have an identified gap, October 31st. Any questions? How many more times can I say any questions? Me too. All right. Here is the contact information for our partners that administer our plans for us. Of course, Blue Cross Blue Shield, Optum, our new pharmacy benefit, and Teladoc that we discussed earlier. I certainly recommend finding Teladoc in your app store and going ahead and creating an account. If you haven't done so, all you need is your 901 number, your contract number, and that's pretty much it. Just put in some other information, and you've got Teladoc. Love that. And then, of course, Southland and Connect Your Care. Again, Connect Your Care is for Flex and for the premium cash option. Again, that's one with a great app that I highly recommend downloading and using if you do Flex. And then certainly for PCO. Yes, ma'am.
Will you give a brief overview of the Optum RX?
For Optum RX? Okay, sure. Just real quick, Optum RX, that is something brand new as of January 1. That is our pharmacy benefit. Now, as a new employee that has freshly enrolled in SEHIP, you were mailed a Blue Cross Blue Shield card and then also an Optum RX card. So when you go to the doctor, you would present your Blue Cross card, of course, but when you go to the pharmacy to pick up your prescription, you would need to present that Optum card. Optum also has an app that I love, and you can go on there and you can see what nearby pharmacies, what pharmacies are nearby. You can also, I think, look at the copay on there. I'm having to jog my memory here, but you can look at the copay amount to expect for your particular medicine. And so that app is a really good resource as well. And I like it. I actually do all my apps where I can just make my phone be my login. So that's just one less thing I have to remember.
Sorry, we're kind of newbies.
Yeah.
We're over in education, and we came in the middle of COVID.
Yay.
So this is kind of our first training. You said 60 days for new employees for, so should we, I mean, we came in April 1st. We haven't, I don't know how many of us have had our screening
For the
yet.
screenings, okay, so right now, the screening deadlines are a little different
Okay.
for new employees. I know we're doing 90 days currently. You have a 90-day time frame. I think we're in the process of evaluating if we need to extend that currently, because we may certainly do that. Again, with everything still happening right now, it's likely that we may do that. Did you want to add?
I can leave some of my cards on the back table, so if y'all are concerned about your grace period running out,
Okay.
you can just call me and I can pull it up and do what you need to do, but you do need to try to get that done as soon as possible.
Yeah, thank you. Yes, thank you so much. I feel like I harass poor Mallory all the time with wellness stuff. So, but again, y'all stop me if you have any questions. You can contact us with this information here. I know it says in person, but again, because of COVID, you can't actually see us in person. But normally, we can be visited in person, downtown Montgomery, 201 South Union Street. You can also reach us by mail using our P.O. box I've got listed here. And again, our website, again, alseib.org, an excellent resource for all things health insurance. And then I've got our contact numbers listed there as well. And we've got myself and Jeannie Blake have our cards back there on that table. And they're also on the back of your benefit guide that I put in front of you as well. And then this is it. This is our very last slide. This is kind of bittersweet. I've enjoyed talking with you all. But this is our benefit advisor information. And you can see that we're separated by counties. We have 4 advisors in total. I am the red advisor. Again, I'm Mary Catherine, and I serve Southwest Alabama and parts of Montgomery. And then Miss Jeannie Blake back there in the animal print. She is a fellow advisor, and she serves Southeast Alabama and parts of Montgomery as well. So that is our contact information. Again, I have our cards back there. I've included cards with your benefit guide. Our contact information is all over the place. So definitely reach out if you have any questions. And with that, I'm all done.
Okay, one more question, I'm sorry. I did not, I'm in the first 60 days.
Okay.
So, but I did not sign up for the flex plan. So, but I need to wait now until November?
You have 90 days.
You have 90 days.
To sign up
Okay,
for
good,
flex.
okay.
Yes, a little extra 30 days.